Hi, this is Dr. Kathy. I want to talk to you today about doing trial of Vyvanse medication for ADHD. So Vyvanse is a brand name, but it is lisdexamphetamine dimesylate is the active ingredient. Lisdexamphetamine dimesylate gets absorbed and it does nothing. The liver chops off the list bit and then releases the active ingredient to the body. And so it's smooth on and smooth off. It doesn't kick in quickly and wear off quickly. Because it takes metabolism of the ingredient that's absorbed before it's going to work, it takes 45 minutes before it starts to work and a full hour before you see that maximum level. In order to do a trial, I've prepared some information and I'll talk you through this now. So this is for my test patient. So Australia has 20s, 30s, 40s, 50s, 60s and 70s. They do have 10 milligrams in other countries, but we don't have that here at the moment. And when someone is starting on Vyvanse, rather than switching from something else, we take it a little bit more slowly. I will write a script for 20 milligrams and 30 milligrams. It started roughly when the person wakes up. They can have it the moment they've woken up and then eat in that first 45 minutes, and then it's going to start to work. So we do 7 days of 20 milligrams, and then you consider, is it enough? If you're not sure, go for another 7 days. But after 7 days, if it's not doing enough work or doing nothing, you can go to 30 milligrams for another 7 days. And then if needs be, you can go to 40 milligrams, which will be 2 20 milligram capsules. After a further 7 days, if you need to go to 50 milligrams, then obviously that will be 120 and 130 milligrams. After another 7 days, if you need to go to 60 milligrams, that will be 120. Sorry, that'll be 230s. After a further 7 days, you could go to the maximum, which is 220s plus a 30. Now, if you keep going with 40 milligrams or above, you're going to start to use up more medication than is ideal per day. What comes with this on page 2 is a letter to the pharmacist that says, we're doing a trial of Vyvanse and just short-term release the medication early. And people have asked, well, what is it supposed to do? And that depends a little bit on which type of ADHD the person has. If they're in the hyperactive, it will reduce impulsivity and hyperactivity. So fidgets, tap, squirm in the seat, running, jumping, climbing, interrupt, intrude, trouble taking their turn. It can be for concentration, which is the lack of attention to detail, poor organisation, forgetful in daily activities, easily distracted, trouble concentrating for a long period of time. And obviously it can be for both. Now, the potential for side effects, too much makes a child too flat. Cut the dose back. That's not rocket science. The advantage of me giving you this is you're in control. It does reduce eating. It can mean that they'll eat less at lunchtime and more in the afternoon and evening. So we've got to keep an eye on that. Also, if you give the medication too late or if they're a poor metabolizer, it can impact sleep. It can provoke a motor tic or a vocal tic. It can make people grumpy or moody, especially as it wears off. With regard to the emotions, you'll need to figure out whether or not this is medication side effects, or now that I can focus, I can experience my emotions more and therefore I feel more emotional. Rare is nausea, diarrhea, tummy pains, shaking, a bit like having gastro. I've not seen vomiting. And it's possible this is a viral illness, so I would recommend stopping it. Try and figure out whether it's just your child or whether it's others. If you're not sure, then restart it and see how it goes. But if they've been in contact with others and no one else has got it, especially if they're quite unwell, you might not want to. We've had a couple of brief heart palpitations. Now, with heart palpitations, please don't wait. Just call an ambulance. The ambulance can put traces on the heart and measure the ECG. We've had reduced saliva, and there's also quite rare muscle cramping, especially in the legs, and that spasm and cramping is reduced blood supply. They're potential problems. And what I ask is, if you've figured out the dose to be 40 milligrams or more, that after 2 to 3 weeks of trialling it, that you let me know. And on the bottom, there's a suggested email that you let me know what they're taking and what their weight is. However, if they're on 20 or 30 milligrams, you will have the full initial script. And so you don't need to let me know, although it's nice to hear when things are going well. So this is how I do a trial of Vyvanse. There are other ways to try this, but that's my way. The other thing which I've come across, so I've had a pharmacist tell a parent that 70 milligrams is too much for a child. Now, the reality is, as we get older, our metabolism slows. And since I've turned 60 last year, I can absolutely back that. And so the top amount is something that should be less in adults, and certainly as we get older, we shouldn't be needing 70 milligrams. It's far more likely for a child to need 70 milligrams. So don't let anyone get confused, because that's a sign that they don't understand the dosing of Vyvanse. I hope this is helpful.